Welcome to the Learning Center. This tutorial is an in-depth look at the next provider of care function. This is updated from the old discharge section known as referrals and follow-up appointments. The new name is follow-up information, which has one element labeled next provider of care. This element is required in the discharge routine. Why is it required? To assure that this vital information, the next provider of care, is available for every patient who leaves the hospital. This meets meaningful use standards. These standards guide health information strategies and affect reimbursement. Meaningful use requires that each hospital electronically transfers the records of at least 10% of discharged patients. This transferred record is known as the CCD, or Continuity of Care document. By completing the next provider of care element, you assure that your patient's CCD can be securely transmitted to a specific individual, including yourself. You can also send the CCD to specific groups or to specific institutions. Institutions are referred to as provider types and include hospitals, skilled nursing facilities, hospices, etc. You can find further details about this discharge element and the meaningful use standards on the Learning Center webpage. Now let's take an in-depth look at this next provider of care. To demonstrate this function, we start here on the discharge desktop. We notice the section Follow-up Information with Next Provider of Care. We notice that it's the required section, just as is discharge medication reconciliation and discharge orders. You can do the next provider of care separately from the reconciliation, though the system will remind you that the reconciliation hasn't been done, and I'll show that in my demonstration. The first step is to click on the blue Edit button. This takes you to the AOM referral window. There are 9 columns. We start with the referral column. This lists the various specialties and provider types. These provider types include PCP, or primary care provider. It provides hospice. It has long-term care, or SNF. And it also has other referral type. In addition to the referral column, there is the group column for groups specific to any one specialty, the refer to column, which is where you put in specific providers' names, number of visits, the service date, which is the interval between discharge and the time the patient is to show up, the diagnosis field, action field, type, and details. The details column is currently not active. For this demonstration, I'll choose family medicine for the referral type. For the group, I'll choose a CHPG practice, CHPG Westminster Internal and Family Medicine. For the provider, I'll choose Dr. Velabrol. Notice that the providers were mapped specifically to the group. Now if I wanted to change this, I would click on the provider and/or the group, and I can hit clear. If I'm not able to find the name of the provider I'm looking for, I can just free text in the name of the provider. In this case, I'm going to stay with Dr. Velabrol. The next column is the number of visits. I'll choose 1. The service date again is the interval between the discharge and when you want the patient to show up. I'm going to say in 2 weeks. The next column is diagnosis. Clicking here takes me over to the problem list, which you're familiar with. I can choose one of the problems that the patient already has listed, or I can text in a new diagnosis. In this case, I'm going to choose CHF. I'll hit save, and this fills in the diagnosis column. The next column is actions, and this is a free text box. I hit OK, and this allows me to type whatever I want. I hit save, You'll notice in the Actions column there is the notation Notes. The next column is Type, and this simply allows me to say whether I want the patient to be referred simply for advice or for assumption of care. In this case, I'll simply choose Advise. Again, the Details column is not being used. I've now completed the next provider of care. I'll click OK. Here is where the system reminds me that I have not yet reconciled the home medications. In this case, I'm going to click OK. This allows me now to save my discharge session summary. This takes me back to the discharge desktop where we can see the referral that I have already made for the next provider of care. We now see that the required moniker is no longer present. At this point, I can now complete documentation for my patient. Clicking into the PDoc section, I'm going to choose Discharge Instructions. We notice in the instructions there's a referral section with a blue edit button. I click on this and I get the referrals window. I click Update Referrals and it fills in the referral information I filled out before. I'll click Preview to show how this looks in the final form. For sake of the demonstration, I'm going to go back to the discharge desktop. Now, in order to be able to print the patient report or to print out a referral or next provider of care form for the patient, I will need to finish my discharge medication reconciliation so I can finalize. I'll go do that now. We're back here on the discharge desktop, and you'll notice that I've finalized the discharge medication reconciliation. We notice that the Finalize button is now grayed out or dithered. At this point now, I can now print off a separate next provider of care form. To do so, I'll click on Print Section. I'll click on the RxM Orders button and hit OK. I'll hit OK again. And this shows me what the next provider of care form looks like. We have the name of the patient, the specialty, the interval, the name of the group, the name of the provider, the diagnosis, the number of visits, and any extra text that I may have added. This does have a signature line, though a wet signature is not required for referrals or next provider of care forms. I'm going to return to the discharge desktop. The last thing I'd like to show you is how the next provider of care shows in the patient report. I'll hit the Preview Patient Report. And here we see the Referrals and Follow-up Appointments section of the patient report, the same information that I had put in before. So in review, the next provider of care function allows us to accurately document our guidance to our patients. It provides paper documentation to help patients with their follow-up care, and it assures electronic transfer of the CCD to the next provider of care. Thank you for watching this instructional video.